asked a few people what they think about county health on our exploration for answers. The following individuals verbally consented to release their information, and these are their stories.
So Ryan,
Yes, Josh.
what do you think county healthcare services are?
One of my favorite discussions.
Okay, good.
When I think about county healthcare, I think it's not city healthcare. And so the fun, I have no idea what county healthcare systems are, Josh.
That's fair enough. Thank you.
Glad I could help out with this presentation.
So we just want to know what you think St. Louis County Healthcare is.
St. Louis County Healthcare. It's a medical service, all services actually, like through the health department and stuff. Yeah, I know where a couple of them are.
Really?
Yeah, over on Jennings and one in South County. Okay. Yeah, I know what it's about. I get my shots there.
Awesome. That's awesome. That's all we need to know. Thank you so much.
Okay, and I'm pretty smart.
What do you think county healthcare services are? Chris?
That's not my question, dog. That's you.
Got nothing. Got nothing? Okay, interesting. So, Chris, your question. What do you think St. Louis County offers for healthcare services?
They probably cover pretty well fat-related diseases because of all the pizza, all the toasted ravs and Ted Drewsby. I would say that I would say that obesity is a huge thing that they cover. But other than that, I'm not entirely sure.
All right, thank you very much.
So that's just me. But
What are your thoughts on St. Louis County Health Services?
You know, I don't have a lot of experience with county health, but I know that it has a place in the health system. It's just that I don't deal with the county health system that much.
All right. Thank you for your time. So, do you know what county health services are?
I have no idea what that is at all. They're health services, so not really sure.
Have you ever used county health services?
No, I have not.
Hey, Shannon, we have a question for you. What do you think county healthcare services are?
Probably services that the county uses to help with healthcare.
Okay, fair enough. Thanks.
So in your own words, what would you say the county health system is?
So when I think of the county health system, what I think about are resources available at that very local level, where they're providing a direct service to those individuals in that particular community. And I also think that those needs vary depending on what that community is.
Okay, awesome, thank you.
So what kinds of services does county health provide?
Well, they assess different health risks. They offer emergency support to residents in time of natural disasters. They inspect restaurants and grocery stores to monitor food safety. Also, they control and monitor the spread of infectious diseases like the flu and tuberculosis. And lastly, they treat chronic conditions of diseases like heart disease, diabetes, and stroke. Here are some other examples. County health services provide preventative and primary care to those living within or around a certain county. They're also used by all types of patients, regardless of age or income. In addition, they accept major insurances in most plans, including Medicare and Medicaid. Lastly, they provide services for kids and teens as well as women and expecting mothers.
To effectively care for the health of the United States, federal, state, and local governments need to be involved. In order for different levels of government to play out their role in the county health systems, policymakers need to provide financial and political support for efficient health agencies. A strong and effective governmental public infrastructure is essential, but due to the poor communication between federal, state, and local officials, weaknesses were formed. This explains why the nation lacks comprehensive national health policy that could be used to better the structure of governmental public health. The federal government's roles are to assess health status and needs, take part in policy development, and make sure that necessary services are provided. State and local governments take on different roles depending on what state is being discussed, but most of the time, the main role is to provide healthcare services that best suit the state in question.
Education, employment, and amount of income can be considered economic factors which can directly or indirectly affect health factors. Education can directly impact the type of employment and income a person receives, and can in turn lead to the type of environment they will live in. Populations living in a lower quality environment with a below average income most likely will have limited access to care, resulting in poor quality of care, leading to potential harm and health outcomes.
There are many social factors that have led to the development of county health services. Some of them include anything from relationships with family and friends, religion, ethnicity, environmental conditions, and access to resources. St. Louis County Department of Public Health provides easy access to all people in the community. It does this by assessing the health of the St. Louis population and the environment to allow easy access and better quality. St. Louis County Department of Public Health's main goal is to continue to make the necessary changes to make St. Louis the best place it can be.
One of the best ways to navigate the St. Louis County Health Department is at their website at stlouisco.com/health and wellness. On the website on the left shows all the different services they provide, like information about diseases, inspecting food and restaurants, and where to go to access services. On the right is different links about different articles. If you click on Health Centers and Medical Services, you will find information about the 3 health centers available in St. Louis County. Scrolling down, you will find information about where they're located, their hours, and their phone number for contacting. It will also list the services provided at each center. If you notice, all centers provide different services.
The St. Louis County Health System has many strengths. For example, data on many St. Louis County health factors are above average when compared with Missouri national averages. Many of these factors are addressed by St. Louis County health systems either indirectly or directly. For example, the percentage of mothers in St. Louis County who received early prenatal care is 82.5% compared with the Missouri average of 75.1%. Another example is that the age-adjusted death rate due to influenza and pneumonia is 16.1% in St. Louis County, which is significantly lower than the Missouri rate of 17.6%. St. Louis County also has organizations such as the Integrated Health Network that help to boost access to health care for the county's residents through partnership with 8 safety net institutions such as community health centers and hospitals. The efforts of the Integrated Health Network include things such as tracking effectiveness and improving patient outcomes, creating effective care transitions for patients, and increasing communications between healthcare providing institutions and researchers.
Guys, we really need to figure out how to advocate and educate these people about preventative care. Can you do it?
Sorry, man, we don't have the jurisdiction here.
Well, what about you?
I can do it.
Okay. Do you want to do it?
Yes, I do.
Awesome. What about you?
Clayton County does not have the authority.
What about you?
Oh, we'd love to, but we don't have the funding.
this bill about tracking diseases in St. Louis County. You need to sign it.
I don't agree with that, sorry.
Fine.
Governor, I have this bill I need you to sign. It's so that restaurants have to print their calories on their menus.
I don't want to know how much I'm eating. No, thank you.
Governor, I have a proposal about STD prevention and protection program. Will you please sign this?
Yeah, okay, I guess I believe in that.
Governor,